Hello and welcome to our American Rescue Plan Act update webinar presented by the Colorado Department of Healthcare Policy and Financing. My name is Patrick Hackney. I work within the ARPA team within HCBS, and we are very excited today to present this webinar to you and give you some both updates about ARPA and some of our projects that have closed. And we have some really interesting projects that we're going to walk through that have recently closed that we hope you as our stakeholders will be interested in. Jen, if we could go to the next slide, please. And here is our agenda for the day. Again, kind of general ARPA updates. We've got a really cool dashboard that we're going to demonstrate. And then as we have sometimes discussed before, most of our projects are going to end in December. And so we've got our closeout plan that we're going to talk about as we wind down some of our ARPA work. And then, as I also mentioned, we're going to talk about some recently closed projects that we hope folks will be really interested in. So, Jen, if we could go to the next slide. All right, so we're going to get into a couple of general ARPA HCBS updates. Jen, if we could go to the next slide. So this is by the numbers. Not going to read through each and every one of these numbers. This slide may look familiar to you if you've seen our previous webinars, but we've updated this slide. A couple of things I'll point out is that we have completed 33 of our 61 projects. We've had over 2,700 grant agreements. We've tried to get stakeholder input and provide information. We've had over 11,000 folks attend our stakeholder meetings and over 100,000 page views on our ARPA website. So if you could go to the next slide, please. All right, I'm going to turn it over to Emily to talk about the ARPA spending update.
Thank you, Patrick. My name is Emily Reddick, and I am the Strategic Outcomes Division Director Manager, excuse me. And I've had the honor of working on this ARPA work for the last 2 years. And just, you can see the enormous amount of spend that we've had to date. $454 million of our $550 million budget has been spent. The rest of it is planned to be either spent in the end of this fiscal year or early next fiscal year through provider payments and rate increases and through finishing our 61 projects and initiatives. So we're very excited that we're almost crossing that finish line with our ARPA work and spending all these funds. So the next slide that we have is related to our ARPA metrics, which is really the flip side of the spend is our outcomes and how we've actually spent this money. And we're going to hear through a lot of information from 3 or 4 of our projects that closed out. But one way that we can see the specific outcomes of our project is through the measures and through these metrics that we have captured throughout this project cycle. And I'm going to just highlight a couple here for you, working on switching screens. All right, we're here. So on our new dashboard, which we launched last month, you can navigate through and see quite a few different things, a lot of different information. On the, we have our global metrics, which is our project metrics across a lot of different projects. So one huge piece of this ARPA HCBS work that we focused on was stakeholder engagement. And you can really see how much stakeholdering we had throughout the quarters of our ARPA work. And also, did it help people with understanding of the work that we're doing? We also focused a lot on training through a lot of our initiatives. And then we had quite a lot of grant programs. We had over 20 grant programs. And we wanted to make sure that not only did we have these grant programs, but that they were being issued to new grantees, people who individuals and organizations that maybe didn't get to participate in the past in our grant programs. So those are our global metrics that we invite you to look at. We also have here on this side, you can see these tiles of all of our different areas of focuses for projects. And each of these areas has at least one metric that we wanted to highlight. There's lots of different outcomes with our different programs. And so some of them have a more graph-oriented metric and some have different types of metrics. But I'll just highlight a couple. And we really encourage you to go to our website and see this. Our workforce projects, of which there was 10, this is one of the outcomes, which was how many learning modules were developed. And the target was 8, and we were able to develop 32. So that's one where we had a really a big amount of success in that project. Another one that I will highlight is our emergency preparedness. So that was another category of projects that we had. And we were hoping to provide battery backup devices for 150 individuals per quarter, and we were able to exceed that in each quarter. I won't go through all of these because we'd love for you to go through and check these out yourself. I'll just highlight one final area, which is our grantee recipient geographic distribution map. And you can just see that the entire state of Colorado received funds through our grant programs. And we're really proud of that. We worked really hard to reach out to individuals and organizations all throughout the state. So those were just a few things that I wanted to highlight and show you all. And I will hand it over to Patrick to talk through our closeout plan and then highlights from our projects that are closing out who are presenting today. So thank you so much.
Thank you so much, Emily. And yeah, we're gonna Jen, if you could go to the next slide and then the next slide. So as you can see, these are a few of the key dates. A couple of them have already passed. We're in December right now, and as of December 31st, as of the end of this month, we're going to try to get most all of our projects closed out and be done with most of our ARPA projects. And then we've got a few months to kind of do some administrative wrap up and also finalize all the spending and finalize the reports that we have to send to the Center for Medicare and Medicaid Services. So, but ARPA will officially end on March 31st, 2025, with most of our projects closing out on December 31st, 2024. All right, Jen, if you could go to the next slide, please. All right, so roadmap ahead. We are winding down ARPA and we are trying to get projects closed out. We've already closed 33 of our 61 projects. We've got 22 additional projects that we're going to try to get closed by the end of this month. And I can promise you lots of folks are working hard to get these projects closed out. We have 6 projects that will close in early 2025. And as I mentioned, we have some administrative things to do once the projects close out. We've got to balance the books, project spending, and then do our final report both on each individual closed project and our final report to Center for Medicare and Medicaid Services. All right, if you could go to the next slide, Jen. All right, so this is the moment you guys have been waiting for. We're going to highlight some recently closed projects. We really wanted you guys to know some of the exciting work that we're doing, and also hopefully it will be informative for folks and they can kind of understand, hey, this is where some of the ARPA money went. All right, if we could go to the next slide, Jen, I'm going to turn it over to Gina Robinson to talk about her project. We numbered each project. Hers happens to be 811, and it's on EPS DT benefits training. Take it away, Gina.
Thank you, James. Next slide, please. This project was really to look at how we could train better around EPSDT. EPSDT, or early and periodic screening, diagnostic, and treatment, is the cornerstone of Medicaid programs to ensure that we have a robust set of benefits for children, particularly those children and youth with special health care needs. Children enrolled in Medicaid are eligible for EPSDT services, and they can be covered under all of the EPSDT rules. The goal of EPSDT is to ensure that individual eligible children get the health care that they need, when they need it, and in the most appropriate setting. What brought this project around is that while that seems like it's quite simple, right? What they need, when they need it, in the appropriate setting, it's not that easy to understand. One of our main challenges in developing the training was translating the complex federal requirements for EPSDT and HCBS into easily understandable content for a wide set of audience. Our audience includes parents, providers, and child welfare workers, all who have a different view and need from EPSDT. One of our vendors in the project, SE2, conducted focus groups with parents and caregivers. And out of the 142 interviews, 60% of those said that they were unfamiliar with EPSDT, the concept of EPSDT, and the concept that Medicaid and Health First Colorado includes hearing, mental health, preventative care, vision care, and dental care. In order for Colorado to meet the goals of the right care to the right child at the right time in the right setting, we developed under this ARPA project comprehensive tools for each of those separate populations. The tools also serve to bridge the gap between the EPSDT services and other programs, such as HCBS, ensuring that we have better integration of care for our members. The parent toolkit that was developed explains more in depth about EPSDT, including those services that we talked about, hearing, vision, oral health care, and more. As a part of that toolkit, we did develop a storybook to really talk about, right, what EPSDT is for our members. And if you would like to learn more information about Emma and Rosie the Rabbit, please visit our website and you can view the book online. Our contract providers are often the primary source of information for our Medicaid members, and it is essential that they do not assume that under EPSDT and Health First Colorado that we have hard limits on services for children. They need to be able to understand how to convey that members have a right to timely diagnostic and treatment services, and Medicaid should always be asked if they believe that something is medically necessary. For that reason, we developed a desk guide for providers, and it really talks about what they need to know and that there's no list of exclusions, and sets a reminder card for them of just ask. So if there is something that they believe is medically necessary, they should simply make the ask. Also, our videos contain another provider talking about EPSDT, so we have peer-to-peer recognition of that project. The last toolkit is for child welfare workers. For child welfare workers, they actually have the responsibility of care and custody of children who are removed from their homes. In that way, EPSDT becomes very necessary for those services because they may need more services than the typical child. They also need an exam when they are removed from the home, which may be on top of an exam that they had, say, a week before. We want to be sure that there are no barriers to that care and that child welfare workers know that there are no barriers. In that toolkit, we also remind them to contact our regional accountable entities or our RAIs, who can help them figure out what the child has had in the past, where they've been seen, and access to any services that they may have had around immunizations or what medicines they've had prescribed in the past. We sent out 337 toolkits. Those were to, again, counties, advocates such as Family Voices, and all of our providers. We also sent out multiple toolkits to 3 community vendors who have gone above and beyond to place the materials in providers' offices and grocery stores and put up window clings in coffee shops so our members can get the message wherever they may be. The toolkits are available in English and Spanish. And because they are on our website, they will be sustainable simply because all anybody has to do is go click on our EPSDT site, and they have access to the tools and can self-print. We will also use the toolkit and the videos to do push marketing to our members through Peak and other communication channels such as our department YouTube page. We appreciate the money to do this, and we look forward to being able to use the tools long into the future. And James, I will turn it back to you.
Thank you so much, Gina. And again, that children's book is so cool. And then, you know, EPSDT is an important, big, huge part of Medicaid, very important, and helps get kids the services they need. So this was a great project, and thanks for working on it. Next, I'm going to turn it over to Adam Tucker and Jenny Jordan to talk about something that is near and dear to my heart, and that is employment and employment for folks with disabilities. So Adam and Jenny, take it away.
Thank you so much, Patrick, and good afternoon. I want to first just start off by saying, hey, my name is Adam Tucker, and I am the Office of Community Living Supported Employment Advisor. And today also joining us is Jenny Jordan, and she is my colleague on the Supported Employment team. Due to just the time, I'm going to do kind of the heavy lift of most of the presentation. So next slide, please. So really what we're here to do today is really talk about ARPA Project 4.06. And really what this was a pilot designed to improve customer or competitive integrated employment for people who are waiver members on either developmental disability waiver or the supported living services waiver. And really what our attempt was is to actually look at if we create outcomes or if we invest in those outcomes, can we see improvements in members' independence on the job as well as success on the job. And really what this meant was a move away from what our current system in supported employment looks like, which is fee for service, which really is designed to pay for a service and not really kind of thought about as you're investing in that outcome. So next slide, please. And so really kind of rethinking and reshaping in about how reimbursement and what reimbursement is supposed to do from a supported employment basis, really focused in on the idea of independence and job success. Really the idea then shifts more into this investment of the outcome, the investment into what we want the person or the person that wins services to be successful in their job. And so how do we invest and how do we incentivize providers to reach those types of outcomes and to support those kinds of outcomes? And so what we did is we looked at other states and we saw that other states had created similar systems and showed a lot of promise. And so what we utilized this pilot to do was to see if these kinds of systems would actually work in the state of Colorado. And so next slide, please. And so we did a pilot. Next slide. And what we did was we really partnered with a group of supported employment providers that already had the infrastructure, really knew what supported employment was and how to support people on the job. And we partnered with them to go and actually try this pilot out in real life, utilizing members who are volunteering to be part of this, to knowing that this could actually support their peers in being successful in employment in the future. So next slide, please. And so really what this was, it was that movement away from that fee-for-service kind of model. And one of the first steps in any kind of supported employment process or supporting anybody with really finding a job, especially that first job, is to engage in what we call job development. And currently, job development is paid just like all the waiver services on a 15-minute unit basis. What that did is that there's not really anywhere that says we need this outcome. The outcome needs to lead to this individual that is being supported needs to lead to them looking closer and closer at going into a job and being in a paid job. And so how we flipped this around was we moved to a flat rate. And and we paid for the outcome. And so the outcome was a vocational profile that really focused on the member and looked at what their strengths were, what were the right conditions for them to be successful at employment, those different types of things. And when that profile was completed and it was accepted, then that is when the flat rate was paid instead of for that fee for service. Next slide, please. The real kind of nuts and bolts around this, and really where the big change happened, was actually during the job coaching phase. And what job coaching is really quickly is currently is a fee for service system or service that goes and supports people while they're on the job to learn job tasks. The issue with fee for services is that and why it rubs against really what best practices in supported employment, especially around job coaching, is that you're taking something that a service that is designed to fade out as the person learns and masters their job tasks so that they are more independent. But what you're actually doing in fee for service is you're de-incentivizing providers from doing that because they get paid less, which actually turns around and makes it hard for them to continue to offer these programs. And so what we did within the job coaching realm and what we saw in other states and what they have done is that instead of paying for every hour job coaching is occurring, they're paying for every hour the member is working, with then a three kind of phases where those actual rates go down based on the target fade out criteria. And so what that does is it really allows providers to make sure that that member is getting the support that they need, while also not over supporting them, so that they can really focus in on making sure that that member is as independent as possible, especially because with the success side of it, if the member is successful at work and they start to get more hours, the provider gets a higher reimbursement. And if that member is independent, that they're going to get that higher reimbursement without them having to provide more job coaching. And so really that's where the nuts and the bolts of kind of this system kind of works. So next slide, please. And so really when we broke this down, this was still a very small pilot. We had less than 50 individuals all the way through. Our goal was more than 30, just so that we could have a good data set. And we did achieve that, but this really is the kind of the breakdown. What we did, one thing that I do like to point out on this slide is that individuals with those higher support needs, they were lower percentage wise, but we actually saw a higher influx of them as the providers learned how to utilize this system. And so from the very beginning, we didn't have anybody. And then as providers started to learn this, we started seeing people with higher support needs getting pulled in sooner. And so we think that's part of the reason why some of these numbers are off. Next slide, please. So what did we find out? Next slide. And this is the exciting part, is because what we found out was that as the members were working through this, they gained more independence. On average, over a 12-month period, their job coaching faded out by 8%, as compared to their peers who were not in the pilot but utilizing waiver services, which they only averaged 2.5%. And so what that really means is that person is becoming more and more independent in the job because that job coach is there less and less. Well, that doesn't mean much, right? If that does not also translate into the member being successful at the job. Well, what we also found is in that same sample size is that their hours of work actually increased by 11%, which was also, again, better than what you see in their peer group in the waiver kind of world. And so really what this proves and what these models prove is the more that you trust the member to be successful in the job and independent, actually the more successful they actually are. And so really that's one of the things that this showed. So next slide, please. One thing that I really also like to point out is that the success of this pilot was because the providers that we worked with gave us such incredible feedback, and we were able to change and evolve this pilot to make sure that it was working. And so without them, we wouldn't have had such a streamlined process by the end. All of these other pieces that really made this successful, we learned from the providers. Next slide, please. And so what's really exciting is that because of the success, we have moved forward as the Office of Community Living as part of the healthcare policy and financing to include this in this year's budget request. And as part of budget request 11, that's going to go through the JBC process in hopes that we are approved or authorized the authority that we need to actually be able to move this from a pilot and move it into the supported living services and the developmental disability services waivers. And so that's kind of our next big step. And hopefully we can have in the near future implementation of this and really start to see competitive integrated employment programs really thrive and flourish within the waiver system in Colorado. So with that, thank you, everybody. Next slide. I think this is our contact information. Oh, I guess it's not on there. Anyway, I'm going to kick it back to you, Patrick. Thanks, everybody.
Thank you so much, Adam. And your passion about employment really comes through. Okay, so we're going to turn it over next to Judy Mooney to talk about ARPA 611, which was Center for Excellence in Pain Management. Judy, I will turn it over to you.
Thank you, Patrick. The 611 Center for Excellence in Chronic Pain Management will be an ongoing project. I'm excited to report. I am the Chronic Pain Referral Coordinator for this project, and we can go to the next slide, please. So our project had 3 components. The first was to establish training for primary care providers regarding best practices for appropriate chronic pain treatment management. The second was to coordinate appropriate referrals to pain specialists for people who live with chronic pain. And the third was to outreach the RAISE and other providers across the state to build awareness. We developed an accredited training program. We established a process to offer consultations with a pain specialist or a pharmacist, and developed extensive outreach effort around the state in various ways. Next slide, please. To date, 125 providers have participated in the educational series. It's a 2-part series, and those have included physicians, physician assistants, licensed practical nurses, registered nurses, and pharmacists. It was initially offered live, and then several months into it, we were able to make it a webinar that's now on demand at no cost to the providers. Our project team requested additional time and funding to continue to establish this approach. As a resource for members as well as providers, we did submit and were approved a budget request by the Joint Budget Committee through fiscal year 2026. So we will be marching on for a little while longer.
All right, Judy, thank you so much. And again, I think each of these projects, you can see there's an element of how we're going to continue this beyond ARPA and beyond the funding. So this is really, really exciting. And a lot of this good work is going to continue. So another project I'm pretty excited about as well, we're about to present on is 8.8 HCBS Quality Dashboard. So I'm going to turn it over to Jen to fill us in on this particular project.
All right. Thanks, everyone. I'm Jen Swaysgood. I'm the policy advisor in the Office of Community Living for the Administrative and Compliance Unit. So I'm going to be talking about HCBS quality dashboards. Next page, please. All right, so Colorado has participated in member experience surveys since 2013. Currently, we use 4 surveys: the National Core Indicators for Aging and Disabilities, National Core Indicators for Intellectual and Developmental Disabilities, the Children's Waiver Satisfaction Survey, and the State of the Workforce. Next slide, please. So we use member experience surveys in a few different ways to understand member experience, to identify gaps in services, to identify areas for improvement, and to enhance quality outcomes. Next slide, please. So one way that we are trying to enhance quality outcomes is through the development of the HCBS quality dashboards. So ARPA funding was able to provide an opportunity to develop public-facing interactive dashboards to highlight member experience with services, care coordination, self-determination, community inclusion, and health and welfare in an interactive and accessible format. And these dashboards will provide transparency regarding the member experience. Next slide, please. A couple of things that were really important while we developed these was to keep in mind accessibility and privacy. So the information contained in the dashboards meets all the privacy standards. So data is not shown for fewer than 30 participants. And connected to the dashboards is an accessible version of the information. So this document provides an alternative way to access the information contained in the dashboards, and it will be accessible with keyboard navigation and screen reader software. Along with that, we will also have an instructional video that provides directions and step-by-step instruction on how to navigate through the dashboard with helpful tips and tricks along the way. Next slide, please. So while we were developing this, we also recognized and identified some limitations to this. And so the data is only for members who are eligible to complete the survey at that time, and if members provided responses that were deemed reliable. Members who were interviewed were not necessarily the same between years, and the data is self-reported. We had new case management designated service areas through case management redesign. So some of the data between years is going to be aligned a little bit differently. And some of our programs are a little bit smaller, so we have smaller survey sizes in those areas. Next slide, please. And the next steps with this is going to be to increase the survey sample for all surveys, to recognize trends to assist with case management agency training, determine gaps in service areas to increase provider capacity, and utilize the data to support the quality measure set. Next slide, please. All right, now I'm going to give a little demo of the dashboard. So if I can get the access to share my screen.
I think you should just be able to share it.
All right. All right. Sorry, that's a little small. I don't know if I can make that any bigger. I'll try to kind of work through this a little bit. So what we've got here is the kind of overview page for the National Indicators Aging and Disabilities dashboard. So each of the dashboards is going to have a similar template and a similar format. So the first page is an introduction with some interesting accompanying links to like their workforce collaborative, case management redesign information, things like that. An explanation of the designated service areas, and then the limits and caveats that I kind of spoke about earlier. When we're navigating through this, we'd suggest going from the top to the bottom. So I'll go to the next one, which is the designated service areas map. All right, so we are able to filter with service areas. And so if you are interested in knowing about your area in particular, but you don't know what service area you're in, you can go and hover over it. So if you're in Adams County, you can go, okay, I'm in service area 6. And it will hover above it, or if you click on it, it will pop up here in the service area 6 section. And then you can say, oh, that one's close to me, so I want to know about that as well. So you can kind of go through the map and figure out what you want to look at. All right, the demographics page is going to have very similar information of race and ethnicity, gender, where people live, information like that. But this is also where you get the filters page. So you'll also see that we have 3 years of information here. There are 4 adult waivers in all of the service areas. So if you want to filter down to just the areas that you live in or areas that are close to you, you can hit the select all button. It will unselect all of them, and you'll get this thing that says number of respondents is less than 30. And so in that case, you have to make it larger so that it meets the privacy standards. So we're going to look at area 5 and 6, and you'll see the information starts to populate again. All right, in the case management and service care coordination tab, you'll start to see some of the information that was gathered through the surveys. So you've got your respondents up here, and then these are all just kind of highlighted areas. And if you hover over the number, it will give you a little bit more information in text on what this is about. We also have these graphs and tables on each of the dashboards that are interactive. So for this one, it's talking about support staff. And if you want to look at all of it, it's all right here. But if you said, I only want to know a couple of things, you can actually click off the ones that you're not interested in hearing about, or you want to focus more in on a few of these. So you can do that. With all of them, we also have these little icons that give a text version of what is in the graph. And then this little double arrow right here will actually maximize it and zoom in so you can see the information in a much larger scale. And through this, you can still change the information on here as well. All right, and then when you're ready to go back to the regular dashboard, you would just hit this and it will go back. All right, I'm just going to show one other page. This is where we have the quality measures that I spoke about. And again, it's still going to have the same filter. It sticks. Once you hit it into demographics, it'll stay the same for all of the rest of the tabs. So we'll still have that information. And these are going to be some of those quality measures that we report to the Center for Medicaid and Medicare. So you can click into these as well and make them larger. There are the icons that give them more information about what it's about as well. And then these are going to have all the different years as well. So I know that was a really quick overview, but that's kind of the dashboard. So thanks for giving me the chance to show a little bit about it.
Thank you so much, Jen. Really appreciate you doing that demo for you. And if we could go to the next slide, please. So again, kind of wanted to just give everybody an ARPA website reminder. All things HCBS ARPA can be found on HCPUF's ARPA website. This includes information about individual projects, links to some of the dashboards that we've shared today, including metrics and HCBS provider. You can see the previous reports that we've sent in to both the JBC and Center for Medicare and Medicaid Services. And of course, stakeholder newsletters, previous webinars. There's I will just go back and say on the individual project information, there's information about the projects, the project status, if it's open or been completed. And there's also numerous links within the project descriptions that talk about different items that we've developed or different things that we've done using some of these ARPA funds. So that is it for today, for today's ARPA webinar. Jen, if you could go to the next slide, please. Just really appreciate you taking the time to watch this webinar and be interested in our ARPA work. Hopefully you've learned something today during this webinar. And again, if you need additional information, please visit our ARPA website. And thank you again for watching this webinar and for everyone who helped us out presenting today. So thank you very much.